Thank you, Tinashe. Can I proceed, or are we introducing ourselves before?
I think we can proceed. Then we can encourage everyone to, before you speak, you can reintroduce yourself. You can tell us where you are and where you're calling from before you speak, as we are contributing. Thank you. Because I think in the interest of time, we'd like to spend more time on the discussion. Then people introduce themselves before they share their points. Thank you.
You want them to find out basically.
Oh, okay.
But you're not working with CBD.
No, I don't work with CBD.
All right, thank you. Hi, everyone. Good evening, good afternoon, from wherever you're joining us from. So I'm Dr. Eme Yedinu. I'm a medical doctor from Benin. And I think, first of all, my compliments for the new year. Thanks you again for making time for our first Climate and Health Journal Club. Basically, my work is driven towards strengthening health systems, mainly through research and advocacy. So I'm a medical doctor, and one of my fields of interest is climate change, especially how, with regard to its health effects, health systems could adopt environmentally sustainable healthcare delivery model. So if Tinashe allow me, I will start sharing my screen.
Let's go ahead.
Thank you. So please confirm you can see my screen.
Yes, we can. Thank you.
All right. Thank you. So today's session, as Tinashe said, will be focused on how we can focus on delivering sustainable healthcare. So the journal club will be based on a commentary by Setoguchi and colleagues about climate change, health, and healthcare systems, a global perspective to really focus on both concepts. So as we all know about the statement of the World Health Organization that climate change is the single biggest health threat that the humanity is facing, the authors of this article pointed out that this declaration emerged from the recent works done by climate scientists who now accept the reality of climate change and the health effects of climate disasters around the globe. So with this double circle figure, we can notice how climate change mechanisms are causing various effects on health, as stated in the article. So rising temperatures are leading to extreme heat, with heat-related illness and death, cardiovascular failure, etc. And consequently, this is causing more and more extreme weather events that in turn lead to sea level rise that, of course, increases carbon dioxide levels, and all those with their respective health consequences. That's why some also say that health is the human face of climate change. And here we have this graphic that describes health risk, climate change, and potential negative health outcomes. So health risk can be defined as a function of vulnerability, climate hazard, and exposure. So we have acute or short-term hazards such as heat waves, wildfires, or flood. And we also have chronic long-term hazard like droughts, sea level rise, or water scarcity. And with respect to exposure, it really depends on which people are, where people are, whether they're affected, places, infrastructures to hit by those kinds of hazards. And these directly link to vulnerability, such as socioeconomic factors, as we all know, like housing location, demographics regarding, for example, children, pregnant women, etc., who are the most vulnerable population to those hazards. So as we saw on the previous slides, various health outcomes can occur according to the health risks, both, of course, on the physical, but also on the mental health. And we also know that the severity of those health outcomes is obviously influenced by access to healthcare in order to get health conditions timely diagnosed and treated. So the point now is that these patterns taken together point to the urgent need, as said by the authors, the need for healthcare systems and professionals to adapt to the changing that these healthcare needs are bringing about climate change, and really to build resilience to the impact of severe weather events and, of course, other direct threats. And on the other hand, taking a closer look at the down right side of the graphic, we can notice that health systems and facilities are also in turn responsible for environmental threats and massive greenhouse gas emissions. And then our responsibility, we as healthcare professionals, is to undertake actions toward sustainable healthcare delivery. So let's take a quick look at these metrics depicted by the commentary. So the first one is that healthcare systems account for approximately 4.4% of total carbon emissions worldwide. And the common derived ascertainment is that if the health sector were a country, it will be the fifth largest emitter on the planet. And on the other hand, the second one is that healthcare systems account for approximately 10% of total carbon emissions in the United States. And the last one is related to the United Kingdom, where the health and social care climate footprint in 2017 was estimated to representing around 6.3% of the country's climate footprint. So what is the issue? You'll notice that we are now falling within a vicious cycle where climate change is affecting healthcare and vice versa. So that's where interventions are required to really break this cycle of climate change, human health, health system, and then climate change again. And the authors also pointed out that direct and indirect emissions from the healthcare sector were estimated to account for a loss of more than 400,000 disability-adjusted life years from 2003 to 2013, related mainly to the Scope 3 emissions. So we'll discover what is the Scope 3. So usually we use carbon emission or carbon footprint to refer to greenhouse gas emissions, as carbon dioxide has a large share, of course, among the 6 or 7 greenhouse gas established by the United Nations Framework Convention on Climate Change. And then the carbon footprint is just as the best possible estimation of the impact that something is having on climate change. So these emissions, of course, have been classified in 3 categories according to the Greenhouse Gas Protocol, which actually provides accounting and reporting standards for businesses and government. So this is a broad or a general classification. And the scope 1 is related to all direct emissions from the activities of an organization that are really under their control. And the scope 2 is really related to indirect emissions from electricity purchased or used by this organization. So these include, for example, emissions created during the production of the energy that this organization is using. And the last one is the scope 3, related to all other indirect emissions from the activities of this organization that result from sources that they do not really own or control. So these include, for example, emissions associated with business travel, procurement, waste and water use, etc. And the scope 3 is really the greatest share of the carbon footprint. So the application of these scopes to the health sector helps to really break down where those greenhouse gas emissions are generated within the healthcare system. So this graphic has been developed by Healthcare Without Harm and shows the global healthcare greenhouse gas emissions footprint. So for the health sector, the scope 1 emissions are those that are stemmed from on-site burning of fossil fuels at facilities such as ambulance services, anesthetic gases, or incinerators. And they contribute to around 70.5% of greenhouse gas emissions. The scope 2 is related to indirect emissions from purchased heat, electricity, steam, and other energies that contribute about to 12.6%. And the remaining category, the scope 3, is related to the wild use of supply chain that accounts overall to 71% of the emissions caused by the healthcare. So here, although the United States is the second highest total greenhouse gas emitter in the world, we'll notice that its healthcare system accounts for the highest healthcare emissions worldwide. Well, we also know that countries today worldwide are implementing reforms to achieve the universal health coverage, as the authors of the commentaries point out. So the WHO has set up what we call the Universal Health Coverage Index as an indicator to measure countries' progress toward this common goal. And we also know that when it comes to achieving UHC, some issues or questions related to financing usually follow. So some authors have shown that there is a strong but not absolute correlation between a country's health sector climate footprint and its health spending. So generally, the higher the spending, the higher the per capita healthcare emissions are in that country. But the point here, I think, is that the healthcare sector must really undertake actions that align with the ambition of the Paris Agreement, while simultaneously meeting these global health goals, such as universal health coverage and working to achieve the Sustainable Development Goals. So both should be carried out simultaneously. And interestingly, several health systems in multiple countries have long recognized their responsibility to address the climate crisis and have championed sustainability efforts. So they are already leading the way towards decarbonization, so serving as models for the health sector. So we have, for example, the United Kingdom's National Health Service, which is the largest publicly funded health system in the world. And actually, it created in 2008 the Sustainable Development Unit to meet the government's commitment under the UK Climate Change Act. So that year, the country conducted its first assessment of the National Health Service carbon footprint, which actually is now regularly updated and improved upon. And today it now constitutes the longest running effort to quantify healthcare-related greenhouse gas emissions in the world. On the other hand, we also have in United States, Kaiser Permanente, one of the nation's leading nonprofit integrated healthcare systems, which is one of the largest healthcare systems in the country and actually a leader in combating the climate crisis. So in September 2020, even while the country was handling the COVID-19 pandemic, it announced its status achieving carbon neutrality, mostly in scope 1 and 2, but also some aspects related to the scope 3. And it was actually the first health system in the country to do so. Now, the authors of the commentary are now inviting the healthcare community to take action. So they describe common climate solutions that are mostly related to the scope 3, including, for example, medical waste reduction and management, sustainable procurement, safer use of safer and environmentally friendly chemicals, the use of less and even cleaner energy, planet healthy foods, and taking in consideration transportation to or from the healthcare facilities. And on the other hand, the authors uh, pointed out the importance of reducing the overuse of healthcare services, and they defined it as the provision of medical services that are more likely to cause harm than good. So we have, for example, medical products, diagnostic procedures, and even therapeutic interventions. And the commentary also emphasizes the role of that professional societies could play to address this overuse through education and development of guidance documents. And also, according to the authors, the transformation of healthcare systems to mitigate the climate crisis will also require a paradigm shift. So first, we have to shift from the traditional sick care to a healthcare system. So this includes moving away from the biomedical model of health to really a biopsychosocial model that really consider things like health promotion or the social determinants of health. Secondly, the authors also recommended to maximize the benefits that we could take from technological advances in delivering healthcare services, both through telehealth or remote monitoring. So there is also the use of information technology to share records across our healthcare systems that could help reducing unnecessary tests and procedures. And the last and the third point pointed out by the authors was related to multi-sectoral collaboration, where the healthcare systems must play a central role in promoting sustainable businesses and agriculture. So we have to support health communities and enhance social justice. So last, but the third, but not the last one, was the fact that we have also to work in collaboration with the industry sector. So the authors mention our responsibility to work with industry partners to transform healthcare systems and of course try to achieve the target of the 1.5 degree. So actually considering countries' effort to meet the Paris Climate Accords commitments, the author said that many industries will increase their market value by trying to achieve all cost the low carbon footprint. And this could lead to cross-national changes when it comes to multinational companies or corporates. So here, this is according to the commentary, a clear picture of what we are envisioning as success to look like when it comes to combating the climate crisis effectively, we as healthcare professionals. So the point is really to have clear goals. For example, net zero carbon emissions within the next 30 to 30 years. The climate medical education that could be integrated in our curricula, taking in consideration the overuse in the technology, and of course, setting community centers and hubs to really mutualize effort towards this common goal. So that is globally an overview of what we can take as take-home messages from this commentary. Hopefully, some aspects that I didn't take in account will be addressed during the discussion section. So thank you for your attention.
Thank you so much for the wonderful and informative presentation. As someone who's interested in social justice and health equity, I see so much value in investing in resilient health systems and sustainable health systems, particularly in improving health equity globally, because I think most of the interventions that have been proposed will not only will benefit the patients in the end in terms of access, in terms of uninterrupted service, in terms of addressing some of the health financing long term. So yeah, I'm looking forward to the conversation. So maybe a good starting point for the conversation would be to start with the question that's been that's in the chat from Khadija, I think. And sorry if I mispronounce your name, and please correct me when you please inform us how best you'd want your name to be pronounced when you speak. If you can unmute and share your question, that would be great. And I think that could be a good way of starting the conversation. If you can't speak, I'm happy to also read it for the benefit of everyone.
Beyond ending the war, how do you see as a threat to the United States?
Hello, can you hear me?
Yes, we can hear you.
The Director of National
Yes, you said it correctly. My name is Khadija Saidi, and wonderful presentation. Thank you so much for sharing the insight. Yes, I was curious to know if there are results or any projects underway within low and middle income countries on decarbonizing health systems. Because from what I've seen in the presentation, most of the countries that are undertaking this decarbonization efforts are high-income countries. So I'm curious, is there anyone on the call who's doing any decarbonization efforts, and what are the experiences so far? Thank you.
It's an open discussion. Feel free to answer the question, and if you have examples of some of the work that you're doing, that to learn from that. Go ahead, as Aziza, you can go ahead and speak.
Yeah, I just want to respond to Khadija about the low middle income countries decarbonization. So, on our Global Green Healthy Hospitals program, members, which are hospitals, health facilities, health organizations, they actually write case studies. And there's many instances, either energy efficiency, going to renewable energy, tweaking things like their boilers, so engineering solutions. Yeah, and some even plant food gardens at the hospitals as well, and looking at water use. So I do have quite a few examples from low and middle income countries on experiencing on decarbonization projects. It's actually very much possible to work with the very little resources we have to decarbonize because it saves costs in the long term. Thank you.
And please do share links of where people can find information. There's a platform, I'm also trying to look for the links that I've been following that is examples of work that's being done mostly in South Africa, where some have it has examples from different parts of the continent and the world. But some of the projects that I saw there were around water harvesting, and they'll talk about how it has affected, how it has improved security, access to water, and also cut down on the cost that are there. Then in Zimbabwe, UNDP and other stakeholders did a solar for health project, and I think it also happened in a few other countries where they put solar, where they tried to improve access to energy. I think the primary goal was to ensure uninterrupted energy supply to support particularly maternal health, maternal and child health. And but I'm not sure if they've done a study to see how that has overly benefited the institutions. It will be something worthwhile to look at. And I think I agree that these are opportunities that we can think about even after the call around maybe publishing and amplifying more more work that's being done on, so that at least we can also learn from that. Yeah, looking forward to hear more more thoughts from others.
Thank you, Tinashe. May I?
Yes, please go ahead. Everyone, feel free
So
to unmute whenever you want to speak. Yeah.
Thank you. So I've just shared in the chat stories from India on decarbonization, but from a rural public health centers perspective, where in those areas with unstable energy, they were able to invest in solar microgrids that is changing how the health systems function in terms of availability of energy anyway, but cleaner energy in India. We have shared it in our newsletter, and I think that there are some efforts that are being done. I'm not sure if someone was able to document all of them together so that we could have an overview, but yeah, things are happening here and there, not in a systematic way, but yeah, I just wanted to share that. And I have another question pertaining to that, but I will come back later maybe. Yeah, thank you.
Thanks, Ashim, and please do add information on how people can subscribe to the newsletter and how they can also share some of the work that they are doing to be spotlighted in the newsletter. Thank you so much. Yeah, feel free and everyone if to unmute and share. I've seen when people were introducing themselves, I saw a lot of people are doing incredible work. in different parts of the world. So feel free to unmute and share. It would be great to learn from you. And also you can even share your general thoughts around the topic, even if you don't have sort of a specific example that you have. Yeah.
So maybe I can go with my question in the meantime. So I've learned that there is a correlation between and I think Emmy mentioned it while he was presenting on the correlation between the level of health financing and the health system, the subsequent health system greenhouse gas emission. There is another correlation between the investment, the greenhouse gas emission of the health system and the health outcomes that it generates. In other words, the more the health system produce greenhouse gas emission, the better the health outcomes of people it serves. But there is a but. That is true until a certain threshold, which is somewhere around 400 kg CO2 per capita. So that's one information. The second one is that, and that's where my question is coming from. We have health systems in LMICs. Most of them are underfunded and are not really meeting the people they serve needs. In the same time, the needs are growing and the resources are scarce with competition for them in different sectors, including the health systems sector. So how do you think that if we put those two information together, that the health systems in LMICs should invest in like the business as usual investment until they reach the 400 kg CO2 that allows them to satisfy the need of the population. And then at that time, think about how to transition to renewable, because that way it will solve real problem that people are having right now, urgent problems. Or the other ways, the other option, which is a little bit difficult because it costs, it has an investment cost that is huge and that country do not have, or when they have it, they are over competing needs. Should they now invest in renewable energy right now, at the risk of sacrificing other priorities and then not go to those emissions of the health system? So that's a question that I don't have the answer, but I would like to ask it here and curious about what you think about it. Thank you.
That's a quite important question, and that's coming up in different spaces that I've been in when people are talking about transitioning, mainly like the caps in terms of accessing different parts of the world and the current cost of green technology and the need to bridge the gap first before transitioning. So I'd love to hear people's thoughts. And feel free to unmute and share your thoughts. Yes, go ahead, Ross.
Yes, good afternoon, good morning, good evening, wherever you're from. My name is Ruby Ross, founder of CHC Agritech Africa. In CHC Agritech, we are pushing for sustainable agricultural practices, using or promoting microbiome technology for the utilization of beneficial microorganisms. I'm happy to be in the midst of experts, especially in climate health, um, area. I'd like to find out and ask a question. How far or how is the interventions in the preventive health aspect of pushing in decarbonization, utilizing microbiome technology in terms of the as preventive health solution during the primary productions or at the rural level, rural areas level, or in any aspect that's where it is being utilized.
Thank you for the question, and everyone feel free to respond to those questions that have been shared.
I will try to share just my thoughts about the question that Ashim just raised. I don't know, maybe we could try to translate. Of course, the higher the emissions, the better or the best health outcomes. But what if we try to translate this situation to the field of strategic purchasing of healthcare, to taking in consideration informations related to what are we purchasing as health services, infrastructures, and how are they impacting or affecting the climate, to decide whether we are purchasing them or not. So these take in account quality of care, but also integrating the aspect of the climate footprint into our decision making towards investing in the climate sector. So that's just how I'm realizing it right now. Thank you.
Yeah, thank you. And I think another, like what also comes to mind is if you like in a lot of rural particularly rural centers that have no access to power at all, I think it would be worthwhile to already start investing in 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 green energy, particularly because of as as countries are working on expansion of the grid and supply. Because if you look at, I think for countries like Zimbabwe, we for so many years we haven't really achieved much in terms of in terms of in terms of rural electrification and all. So one of the key things that helps a lot and that may help in terms of bridging that gap is really using, for example, solar and alternative energy sources to actually improve access to energy and see how they can also contribute some of the excess energy generated into maybe the grid or the wider community that's there. Um, so yeah, I think it would need like a lot of strategic thinking at high level to see how the long-term benefits of such an investment can make in terms of ultimately improving reducing the cost and ultimately improving outcomes that because most of the leaders, I think there's reluctancy to do that. And I think maybe some of the reasons why in places where the emissions have been high, the health outcomes have been good. It's also because of the development trajectory that we're coming from that we also need to interrupt. And I know there are multiple studies that are being done now in terms of where they are measuring, where some are measuring air quality at health centers and really trying to see how that impacts health outcomes. Then some interventions around painting roofs where some of the heat studies. So I think as we get more and more data and more from such studies, I think it can also really give a more comprehensive picture around health outcomes and emissions at institutional level and at different levels that are there. Yeah, I see Alex has posted something in the chat. Would you like to share? And Vitalis, I saw you wanted to unmute. Go ahead and share your thoughts.
Thank you so much, Tinashe, and greetings to everyone. Very interesting conversation. I got two quick questions. The first one is, do the policymakers and the ministries responsible for health actually understand what we are talking about here? Do they know that they also are playing a role in carbon emissions? And secondly, that they have a role also in mitigation? Because we can talk about this academically, whereas at the level where it's supposed to be happening, if they don't know, then we are still in trouble. The second question is really the elephant in the room. With the withdrawal of the United States from the Paris Agreement and having seen that they also play a major role in carbon emission in their health facilities, what impact is this going to have on the whole aspect of healthcare and emissions? And also maybe we ourselves who are in other countries, how do we feel about the United States doing what it has done? Thank you.
Those are quite important questions around bridging, I think also bridging the gaps between policy and action and really priorities. And I think it also comes to a bit on what Ruby had asked around some of the decarbonization efforts and question around decarbonization efforts in prevention. And then of really looking at political will, looking at the direction that's taking. And I'll just quickly comment on Trump and like the Trump election and the current direction that the US politics are taking, considering how the US has so much influence globally. I foresee a lot of other countries likely trying to go in that bandwagon, unfortunately, in terms of finding excuses to reverse. So I think this is a critical moment for all of us as health professionals really to start pushing for against this this development, and maybe finding ways to translate a lot of the academic and the scientific data into language and ways that the community can understand, because I think community ownership and partnership is very critical in this moment, in terms of really pushing for the political motive, because most politicians are driven by what is popular amongst their constituencies. So their agenda is driven around that, because most of them are interested in winning the next elections, and most corporates are interested in profits. And so I think if there is pushback from communities, I think that can really also have some significant push to influence some of the politician priorities. Yeah, looking forward to hear people's general thoughts around that. And around like the issues Vitalis has shared, the ongoing conversation, the question by Ruby.
I humbly think that yes, we need to go beyond academic discourse and debate on this topic and bring it to a wider audience, to the layperson everywhere in the world, because it's something that we are all in together in a way on or the other. The second thing I would like to say is let's not be naive. It's not because the politicians will know what to do, what the threat is and what to do about it, because actually we know what to do about it. That's not the question. It's who is courageous enough to take action, the right things to do. And that is where things get a little bit complicated, because it means that the incentives on which, as politicians or whichever capacity you are, you go against your own incentives, which is a little bit difficult. And I buy into what Alex also said. As long as the outcome, the economic system in which we are, the capitalism, because let's face it, what Donald Trump is doing now is for the money and for the financial well-being of not even all the American. It's for an oligarchy of people that have money and want more money, because his fight now is on AI. We are not talking about it, but AI also is a greenhouse gas emitter a lot. It emits a lot to train the models, etc., and to use them. So as long as the outcome will be monetary gain, accumulation, etc., as long as the poor people will expect their country to be prosperous financially at the whatever it takes. So for me, I feel like our role now is to go beyond knowledge translation to, okay, how do we really make people do what they should do? And I'll stop there and listen if you have any thought about that. Thank you.
Let's go ahead, Shiza Malik.
Hello, hi, thank you so much. So I've just been following this conversation, and it's put a lot of things into perspective. I have 2 points. One perhaps relates to the conversation we were having on decarbonization earlier, and the other on how things have progressed and are continuously progressing in light of Trump's decision regarding US aid. Given that Pakistan's major contribution to greenhouse gas typically comes from our energy and agricultural sectors, it gets very challenging to talk about decarbonization with government and non-governmental stakeholders, particularly in the context of our healthcare sector, which is already, especially after the 22 floods that we experienced, is at an all-time resource shortage circumstance. So that becomes very challenging. But I do see, after listening to everyone, and all those, also the resources that have been shared in the chat, that there are benefits to communities and to grassroots indigenous people to invest, at least at a small scale, in certain decarbonization efforts, particularly for BHUs and smaller clinics in rural settings. The second point that I wanted to reiterate is I feel like as you know, the entire world is reeling from this decision, that Trump and his administration has taken. What now, particularly the Global South, ought to contend with is how do we move beyond this incredibly crippling dependency on aid, and how do we build philanthropic connections within our own countries and also with other partners that perhaps we have not worked with before. Because oftentimes we may not have all the resources within amongst ourselves, but trust can go a long way, especially when it comes to lower middle income countries like Pakistan, Bangladesh, and so on. So I would love to hear what everyone has to say on these things. Thank you.
Thank you so much. And I've been reflecting on some of the lessons from um the early days of the HIV pandemic and some of the advocacy work done by Treatment Action Campaign and other global groups to bring about access to ARVs, and really looking at broadly some of the changes that are happening. I'm thinking to myself, how can we as health professionals and health professionals, thought leaders, academics, and like various climate change aspects, how can we work with movements, with grassroots movements in terms of really bringing in that pressure, to bring in that community organizing, to bring up that change that we want, that may not really come from sometimes the politics, but the priorities, politicians have different priorities around prioritizing efforts. So, would love to hear people's thoughts. And sorry to put Nathaniel on the spotlight, but I know you're working closely with communities on the ground. So I would be interested to really hear about conversations happening with Akofe around around this, as if you're willing, if you're in a space to speak.
Thanks, Tinashe. Yes, happy to share. My contributions or thoughts will center around, I'll say, trying to be the change that we need to see in the world. And I've sensed that there is a lot of emphasis on that point that has already been shared. So my pathway within healthcare has been somehow disappointing in seeing that being a change maker within an established system is quite difficult, and enough times you can fail. And so that's where the movement building component, which you just referenced, Tinashe, together with community members or the most impacted groups of people, Indigenous people, people living with disabilities, children and youth, etc. So that seems to me to be where there's the most promise. And I also see that as a response to getting away from the dependency on aid, is that if we look at the movement building component and intentionally try and co-create representatively diverse spaces that are beyond borders or transcend borders so that ideas and best practices can be shared. And so referencing some of the material that was presented in the paper, just thinking that there was a point that I feel like was not adequately addressed, and that is somehow building networks of either health professionals or people even with an interest or a stake in healthcare as a system or sector within society, that if we can try and initiate and strengthen networks where we can connect with each other and really make it so that being a change maker is not exclusively reliant on whatever you're able to accomplish within your own vertical system or structure, because enough times those systems are operating within the status quo of capitalism and healthcare as a profit-making business as opposed to a care and service delivering sector, which I know that was referenced in the paper as the outcome that we're aiming for. So just a few ideas to share are that somehow the partnership or collaboration framework should be a call to action that is collective. And if we can just see how we can utilize existing spaces and opportunities like the COPs or academic conferences or even global dates of significance. And so thinking ahead to April 7th, we're part of the organization that I represent, a COFI, and also another one called Clinicians for Planetary Health. We're thinking of doing a webinar that ideally would be rooted in actions that happen on the ground that highlight the importance of a diverse system of caregivers and caretakers, especially with children and planetary health as the focus. So essentially trying to highlight the importance of balancing and bridging between traditional systems, traditional healers, community health workers that are often underappreciated in the work that they do, together with the modern world. And so that's a proposal that we can see about developing that virtual webinar together, along with real proofs of concept of ways that people who are health professionals and health advocates are somehow reconnecting to our own roots and understanding the importance of our connections, our relationships, our groundedness in nature, and how much we owe to our ancestors and to indigenous wisdom that we are one with each other and with nature. And last point to share would be just thinking about specific opportunities to connect with each other and learn more about the work that we're doing. So early August, we are planning a research conference in Kenya, among which we'll have a pillar that focuses on greening healthcare and specifically building networks similar to the ones that you, Tinashe, Hashim, and Aime are doing in this amazing space. So just want to share gratitude for the opportunity to share and connect, and somehow invite and challenge us all to lean in and remain connected, because ultimately I think it depends on what we're able to do to be the change makers to affect the change that we need to see. Thanks.
All right, thank you so much. Thank you so much, Nathaniel. And I encourage everyone to share their networks, and I've seen people already started sharing their LinkedIn, because the idea is to continue this conversation even afterwards. And also the idea is also to network and build collaborations so that we can continue learning from each other. I'm looking at the time, we're now on the hour. Before we wrap up, is there anyone who has a burning contribution that they would like to make before we close?
Yeah,
Not
Vitalis again.
Oh, sorry.
Yeah, go ahead, Vitalis.
Somebody talked about HIV earlier on, and I thought the concept of mainstreaming probably helped us a lot, where we said every sector needs to understand, one, the role they play first in creating the disease, and how then they can mitigate. Maybe this is something we can also do with climate change. I've seen it somewhere, but I don't think it's really practiced as it is supposed to be. If we could have education understand what role they play, agriculture what role they play, at the end of the day, I think this mainstreaming will make us understand what's happening much more better than what we are doing now, that the health talks on its own, agriculture talks maybe on its own, and so forth and so forth. I went to Fiji a few years ago for a disaster risk reduction conference, and they took us to a primary school where children taught us about climate change. And when I came back to Africa, I started asking from primary school all the way to tertiary education. And I was shocked to find out that our children had no idea about this. And yet children in the South Pacific, because they are actually already impacted by climate change, know it from sub-A. So maybe we can also start doing that to make sure that our young generation understands what's going on around them. Thank you.
Thank you. I'll have Ruby, then Hashim. Then I think it goes up. And feel free to share links and that people can follow in the chat. Thank you.
Yeah, thank you very much. So thank you so much. I really like what Vitalis just said about making sure that more and more people are aware of what's happening, especially children. And I know from Nathaniel's work that they have he's a pediatrician, emergency pediatrician, I think. And I know that they have a lot of focus on children in their work. And the remark that I just wanted to make is that from what we have discussed, I've noticed that we have much more unanswered questions. We have much more questions, unanswered questions than answers. And that's something that's not bad at all. And I'm really happy that we were able to make this. Thank you very much.
Thank you. Go ahead, Ruby, then Rebecca.
Hello, good afternoon. Sorry, good morning, good afternoon, good evening. Yes, so moving ahead, I like the conversations over here and I'm learning so much. I think all of us here have their individual networks and group of, organizations where we could really share our solutions in climate health action. With us here in CHE Architect Africa, we believe that reducing greenhouse gas emission by reducing antimicrobial resistance usage from the primary production, poultry productions, animal productions, and even fertilizer usage, helping farmers transition from conventional to sustainable agriculture. I believe that just a suggestion, we can all be resource persons to future discussions and probably leverage on our networks, our organizations, so that we can increase the level of awareness of each and everybody's solution and innovation. Thank you.
Thank you. That was a great conversation, and I agree that this is a rich network, and there have been many questions. So I've shared our email addresses. So feel free to, like, as you're processing and reflecting on this conversation, feel free to reach out to any one of us if you have suggestions on what we can prioritize next month, like as a follow-up to this conversation. Like in terms of particularly the question that you said, we will then also share with us any resources that you have that you could share during the course, so that when we send out the recording to everyone who's been on the call, we also include the resources that people can share, including links to your various networks and platforms that we can explore. And we also send information around the newsletter. But we're really grateful for this conversation and for everyone who has made time. Let's keep the conversation going. And thank you so much. And feel free to share your thoughts on the plans for the next session. I don't know if Hashim or Ame, you have any closing remarks.
Oh, no, nothing special. I think the debate was really insightful, enough. Thank you.
Just saying thank you to everyone who participated and who contributed to this rich discussion. There are still a lot to do. As I was saying, we have a lot of unanswered questions, and that shows that there are a lot to do. And yeah, let's keep in touch. A way to do that will be, this is a space that anyone can come, and if you have any idea to share with folks, you can just drop us an email, and yeah, we can organize that happily. So feel free to engage with us and to tell us about what you are doing also. If we can feature it in the newsletter, if we can participate, etc. It will be a great way to keep collaborating. Thank you very much, and bye-bye.
All right, thank you, everyone. Bye-bye.